Assalamu alaikum, the communication day. First scenario, Mr. Khalid, 45 years old man, came to the diabetic clinic for follow-up. His blood sugar readings are persistently high, fasting around 9 millimole per liter. His body mass index is 38. He was started on metformin last month but hasn't taken it, saying it causes stomach discomfort and he wants bariatric surgery instead. Your task is to discuss the role of metformin, clarify the indication and the risk of bariatric surgery, help him to understand the best course of action for his diabetes management while addressing his expectation and empathy. Ready?
Yes.
Okay, here you
Hello, Mr. Khalid. I'm Dr. Mansour, one of the doctor in the gland clinic today.
Hi, doctor.
Can I confirm your name and age, please?
Yes, I'm Mr. Khalid. I'm 45 years old, doctor.
Nice to meet you, Mr. Khalid.
Pleasure is mine.
I'm here to talk about your medical condition. Is it all right with you?
Yes, doctor.
Okay. Can you tell me before starting more about your medical conditions?
And doctor, as you can see, I'm of a very big size. Just some months ago, I was diagnosed of having type 2 diabetes, and I was briefly explained what it's all about. And I was placed on one drug called Metformin. But doctor, I'm not comfortable with the drugs. Whenever I take these drugs, I usually have tummy ache, loose stool, and sometimes I feel nauseating and vomiting sometimes. I
So,
don't like it. Yes.
sorry for that, Mr. Khalid.
No worries.
And what about your results of blood sugar?
Well, I did one this morning, which was around 9 millimoles per liter. And I don't really like the drugs, doctor.
Okay. Let me to discuss with you first about the disease and what is the possible treatment for this disease.
Yes, the doctor I met the other day told me that he's going to start me with metformin, that it will help with control my diabetes. And I started it, but as I took it 1-2 days, I didn't like the drug, so I've not been taking the drug that regular because of that, doctor.
Yes, I understand this. I want to explain for you this disease, diabetes mellitus type 2. This is a long-standing disease which accompany you lifelong. The cause of this disease is due to failure of release of chemicals, protein from your gland in your body called pancreas, which release hormone or protein called insulin. That one cause, but this occur in late stages of this disease in your case. The other cause of this disease that there's some tissue in your body called fat tissue, which normally under the skin, make it is difficult for this insulin to work. Are you following me?
Yes, doctor, they've explained to me about the diabetes type 2. I've been explained, they've explained to me about it. I just want to lose weight and get this diabetes sorted out, doctor.
Okay. I understand that, Mr. Khalid. The treatment of this disease, one of the treatment possibility is to give drug to increase the working and the action of this hormone, which called insulin. This drug is called metformin. Every medication in the medicine has action and has side action. That means no medicine 100. If no side action, that's called in medicine no action.
And that is why I wanted to do surgery, bariatric surgery. I read about it. I want to just do the bariatric surgery and get my fats sorted out and my diabetes sorted out.
Yes, I understand, and I will address this comment, but let me for 2 minutes to discuss with you the other treatment possibility. Besides this medication, what's called metformin, there is another medication. One of them or two of them help in losing weight. One is tablet, you can per orally taken, and the other is injection every week that help to control your blood sugar and also your weight.
Okay.
That's one thing to want to address with you. I will offer you the other possibility to lose weight and also improving the control of your high blood sugar is the bariatric surgery.
Good. That is what I want, doctor. That is just what I want. I just want to do the surgery and get sorted out once and for all.
Let's discuss with you the possibility of surgeries. There are two operations. One is to make your stomach small, and the other is to transform the passage of your foods through your bowel from one side to another side to prevent your body to take it.
Okay, you can give me either of them. I don't care. Just do the surgery for me, doctor.
I understand that, but let's discuss to be complete picture of this operation. This operation may be considered, however, nowadays we are making this with minimally invasive. That was a small opening in your tummy, but this operation carry many risks also. One of them is bleeding, and you will take numbing agent, what's called the anesthesia, which has also complication, maybe inflammation of your lung, injury of your airways, maybe infection. And the other important thing what I want to be with you clear is this: when you have this operation prevent your body not only to take glucose, but also essential vitamins and minerals, for example, iron and calcium. That means you should, in routine follow-up every 3 months at least, and also about once yearly to do camera test, because there is also late complication of this procedure may happen for your stomach injury or something otherwise. You understand me?
Yes, I do. I do, doctor. I do.
That's why I'm here to discuss with you the different possibility for the treatment of this disease, and it is called nowadays shared decision making, that the patient take part in the decision how to be treated and know what is the benefit and what is the risk.
2 minutes left.
Okay.
What's your opinion now? You can
Well,
take time and
yes, you've told me some of the risk, but you didn't tell me any benefits of it. Why? Because I read that it's beneficial. It can control diabetes. It can also help my body condition.
that's right. But I mentioned also the side effects. Okay,
But I have many colleagues that have done it, and they are okay.
Okay, I will refer you to a group of doctors, including gland doctor and surgeon and specialized nurse and dietitian, to prepare you for this procedure. I have some question, Mr. Khaled.
Okay.
Do you smoke?
No. I used to smoke, but I've stopped smoking, doctor.
Do you drink alcohol?
Occasionally, I do. Occasionally.
Okay. What are you doing for living?
Actually, currently, I'm not employed. You know, I'm not employed. I just lose my job.
Sorry for that.
Mm.
Should I will refer you to occupational therapy to help you in this regard. Do you drive, Mr. Khalid?
Yes, I do. I drive.
Okay. Do you have any difficulty in walking or numbing or loss of?
No. I'm okay. I can see. I can walk, like you can see.
Okay.
I just want to do the surgery, doctor. I just want to do the bariatric surgery and rest.
Okay, time is up. Thank you, Dr. Ahmed, for taking the case today. Dr. Henry, you can comment now, please.
Dr. Amal, thank you. That was a good case, and this was my one of my communication case in my exam. And it wasn't. In fact, the surrogate was just on top of his voice. He didn't even allow me to speak. He would just continue to rant. He just wants the surgery. He just want the surgery. It was kind of, before I know what was happening, time up. But it was okay. But I think the scenario here is a common case, especially for Dias 3 last year. It occurred in several centers. Even in UK, it occurred. I think in which I'm one of the people that took the exams. The issue here is that since the patient has is having the side effect of metformin, you should have first of all probably assure him that you may need to change his medication to a modified releasing one or a slow releasing metformin. These are one of the things that I mentioned, and they said yes. At least they gave me mark for saying that, in which you did not say that. So suggest first of all, because the agenda here, your task here is to explain to the patient the benefit of metformin, the benefit, the role, and the eligibility criteria for bariatric surgery. So you have to explain to the patient, one, first, in the benefit of the metformin in this case, and two, the eligibility criteria, in which is not really throw more light, if he's eligible for the bariatric surgery or not. And you didn't really make mention of his BMI to him, to further, because it's part of to see if he qualifies, in which in this case, although he qualifies, but he has to fulfill the criteria, which has to be, he has to be to pass through a process or a protocol, which he has to be pass through a protocol that will involve an MDT, the dietitian, what they call a strict diet protocol by dietitian. Not only that, too, exercise, advice on his exercise. You have to know the kind of exercise he was doing before. If he's not doing it very well, then advice on his exercise plan. And then also you need to discuss with him in terms of his lifestyle. So then also, if he has fulfilled this criteria, then and only then you now have to tell him about the risk factors, or probably the risk of the bariatric surgery in which you did, and then tell him that, okay, even after the surgery, you still have to go through the same protocol of the exercise, because it's not just doing surgery and just hands up that is done. No, it's the same protocol, the same exercise. You still have to continue the same strict diet and other protocol that you are supposed to advise him on. I think also he did not also ask up my concern in this case. So for concern, he did not really get he didn't adjust my concern. So for concern, I'm sorry, I may not give you the mark for the concern, because it's not welfare. At least welfare, you got the full mark in the welfare. They think which of that's the clinical judgment. I'll give you. You did very well. However, like I said, it did not tell me about the criteria. If in terms of introducing me to the strict protocol as regards to the both MDT, as both the dietitian, the other endocrinologist support group, and the rest of them that will be part of my medical plan, in terms of weight loss, advise me how to do, how to see if what I've been doing before is the right way, and they put me on the strict observation protocol in that regard. I think basically these are just some of the things, and then also I would prefer sometimes use of reverse psychology to ask me, do I have any idea what bariatric surgery is all about? I know my idea about the surgery first of all. So you can use reverse psychology to probably enter me, gain access to the patient, at the same time advise the patient and see, if he's willing to go by your own suggestion. What other thing to outside that, reassurance? Okay, you talk about, okay, you discuss the consultants as well as other, you know, surgical teams like that will be in charge of the bariatric. So I think these are my own contribution. Thank you, Dr. Muhammad. Thank you.
Okay, thank you, Dr. Henry. I wrote on the chat box the skills and the judgment. So for the clinical communication, you will give about the line, right?
Yeah, clinical communication. Yeah, yeah,
Yeah,
yeah,
for the clinical judgment
exactly.
as well, the same.
Yeah.
For the concern,
Concern, it did not address all my concern, Dr. Bazin. So, but I'll be kind enough. I can give him the 4, like if giving him is okay.
so any missing concern he didn't answer, you want him to
Yeah,
say?
one of the concern
Okay,
is that is there any medication like that
yeah.
that can so ask that medication, and then the other concern is, after the surgery, am I going to require another? That's the only concern. After surgery, am I going to be on medication again, or that is all? That's the
Okay.
concern. Yeah, basically.
And the welfare will be satisfactory.
Yeah, welfare
Okay.
is satisfactory. Yeah.
Yeah. So please, Dr. Ahmed, you can send the scenario for Dr. Inari or prepare a scenario if you have. Send it direct to the chat box. My comment for you. The introduction went good. You introduce yourself, but better than asking, can you tell me, or give me, or tell me your name and your age? Can I know your name or your age? If you forget the name, only you can do so. Otherwise, they don't like the way that you forget the patient name or you forget the patient age. So you can start by confirming his name. You write in your paper, Mr. Khalid, he is 40 years, and you can start with this. I am Dr. X or Dr. Ahmed, one of the doctors here. I prefer to say always one of the doctors here, okay? Because I didn't see what the clinic or department. Anyway, in the exam, you might forget what position, what the clinic. So the best way is I am one of the doctors here. Then your name is Khalid. You are 40 years. Yes, I am. We are here to discuss about your health condition. What do you know about your condition so far, and what the expectation of the meeting? What unnecessarily done by Dr. Ahmed? The explanation of diabetes. So I prefer always before starting explaining a condition, explaining a disease, or explaining a medication, ask him, you want me to explain or no? Because what you explained already type 1 diabetes and the type 2 later on. But maybe he's not caring about the types or the mechanism, or he knows them. And he told you, doctor, I don't want to know. I want to do the surgery. I know about diabetes and I want to do the surgery. So what to do in this situation? Always ask him, do you want me to explain about your condition? No, doctor. Please go ahead with the task or whatever. Tell me what happened with the result or whatever the task. That's why I always say, please start straight away to the task. Do the task because you don't have time. What take the time from Dr. Ahmed? The explanation of the disease. Okay, so it consume a lot of minutes. So what I have to do, I want to convince him about metformin. There is side effect of any medication. I agree. But always also we have another solution. As Dr. Henry mentioned, there is sustained release or another type of medication, or we can change the dose. Try to find a solution for this medication because this is the task. Talk about metformin. Yeah, there is GI upset, so you can take it after the meal, or you can change the dose according to the either 5 BID, 500 or 1000 BID or whatever. We can reduce the dose. You can change the as Dr. Henry said, the type itself of the medication to the released one. This is as clinical judgment, by the way, so it's one of the solution. If no, you can also convince him with some medication can help for the digestion if there is possibility to have. If no, you can tell him we can address this effect of medication, and I will sit with you again. I will try to find another option or another solution. No, doctor, I don't want this medication. But here the task is about metformin, so I have to talk about metformin. He should take it temporary. No, doctor, I want to do the bariatric. Okay, we will come to this later on, as you did. Later on, we'll talk about the bariatric option. Okay, you finish the task of metformin. Now the time for bariatric. Yes, there is possibility. However, we didn't yet decide that in the best interest of your condition to be done this surgery for you. The best interest for you now to take the metformin and don't offer other medication. I heard you are offering medication which is not written in the task or in the scenario. I don't think they can forgive you about this unless it was written there or it can help as a clinical judgment point of view. I'm not sure if there is medication you can offer here to help the metformin action or the side effects. Okay, anyone knows about that? He can share it to the chat box. I'm not sure anyway. Now let's talk. Yeah,
In the
yeah.
scenario not written
Sorry.
in the scenario was not written anything about other medication.
Yeah, yeah.
Yeah.
That's why I'm saying no need to mention other medication.
Okay.
You mentioned medication, right? What you said?
Yes. Yes. I mentioned, I mean, SGL2 and
Yeah, no need.
glucagon.
Exactly. No need to say any offer or any other option unless it was written there. Okay.
Oh,
Okay, let's go back to the bariatric itself. As you said exactly, any surgery carry the risk and the benefit. And usually we are weighing the risk to the benefit. If the risk are more, we can cancel the decision. Or if the benefit are more, we will do and we will go the surgery. Uh, so you give the options that there is two options, the cutting some of the stomach parts. Then the other one will change the way of the food to the bowel or to the gut. Also, it will cut some of the bowel, and both of them carry the risk, some risk. One of them, the bleeding, the infection, and the less the other option or the other risk will be for the long term. As you said, the absorption of some essential elements or substance to the body. Elements you can say iron, calcium, even vitamins. That's why you will be kept on another supplements lifelong, and you have to be sure that you are taking these supplements lifelong. Why? If you are not taking this medicine, you might have some deficiency of these vitamins, and it might affect your life. So, how are you thinking about that, or how that sound for you? If he's agreed, as you said, it's shared decision. So now the time to refer to group of doctors and we will see and decide according to the best interest of your condition which surgery can fit or if the surgery itself can be done for you after the multidisciplinary team or group of doctor decision. We will sit back with you and we'll let you know about our decision. Okay, because here in this scenario they didn't say that the bariatric is the best option for him. Okay, then as you said, the social, personal, do you smoke, do you drink alcohol? He mentioned to you that he's drinking alcohol, but you didn't ask, and you didn't offer what he should do, right?
He said occasionally.
Yeah, occasionally, by the way, sometimes to address any alcohol, occasionally some patient or some person who's taking alcohol, they are taking as binge drinking occasionally, but binge drinking. This one will affect his also, it will affect his blood sugar and the control of his blood sugar, right? So you have to know, yeah, if he's exceeding. So the best question here, are you aware about the limit? Yes, doctor, I am. Are you taking as binge drinking? No, I am not. So this enough. Smoking as well. Smoking cessation always. Yeah, I mean stopping this the smoking. But alcohol, because they like the alcohol, you cannot stop the alcohol. At least moderate or to be aware about the intake of the limit of the intake. Okay, this is the way how to address both alcohol and smoking. The job as you did, but don't ask about other complication of diabetes. It will be considered as taking history. You have any peripheral numbness or other complication of diabetes? No, you can say. Please be informed that you have to be following with our doctors, the kidney doctor, the nerve doctor, the eye doctor, because diabetes carry a risk of these complication. Again, not allowed to take history in communication scenarios. How to do it as advice? Please be sure you are following with our doctors. You have to read about the complication of diabetes because it's a long-standing disease and it carry a risk and it carry a lot of complication into your organs, including the eye, including the heart, including the blood channel, including the nerves, including the brain, stroke. Okay, this is the way how to address it in a simple way at the end of your or when you hear the 2 minutes left. Clear, Dr. Ahmed?
Okay, clear, Dr. Bassam.
Yes. Okay, thank you too. Any question else or any comment from others? Dr. Hina, you want to add anything?
Not at all, no.
Okay,
So, Dr.
let us.
Basim,
Yes,
Dr.
Dr.
Basim,
Mahjoub. Yeah,
just
continue.
in this scenario, I will just regarding the bariatric surgery. Regarding the metformin, I will give. He already expressed why he doesn't want to take it. So my role, I will give him the benefit of metformin. This is number one, right? Number two, I will just give him the what is that eligibility criteria. I will say, for example, for him he is eligible for bariatric. Then I will give him the risk or what I will do, because here in the task I said the benefit of metformin. This is clear. So the role and eligibility criteria for bariatric surgery, and in the scenario also clarify the indication and the risk of bariatric surgery. So I will give him the.
Exactly. Yes.
I will just give him the indication. He's eligible, sir, by his uh,
By his body mass index.
by
Yes.
his body mass index, and he's diabetic.
Yeah, but it's not the main task here. So you
Yeah,
will start with the metformin first.
in, yeah,
Then you will give him the option of the surgery whenever it's okay after the decision of the group of doctors. If they will decide, we will sit with you and we will counsel you about this surgery. Because it's
okay,
not the task here. Yeah, there is possibility to do the surgery since your weight is more and you can get benefit, but also you have to inform him about the risk side effect of any surgery, especially those bariatric surgery carry a risk of complication of vitamin deficiency, the infection, the bleeding, the failure, the leak, even the leak. There is possibility of having a leak after surgery, as you know,
yeah,
right?
yeah,
So it's the task mainly here with the metformin as a medical and pharmacological option. Later on, talk about the surgery itself, the option of the surgery.
yeah. Thank you.
Okay, most welcome, Doctor. Thank you, Dr. Mahjoub. Let's read the comment. The scenario for Dr. Henry. Mr. Sebastian Schneider, 32 years old, suffered from traumatic brain stem death after road traffic accidents. Speak with his mother about his condition and discuss about possibility of organ donation. 2 minutes, Dr. Henry, then we'll
Yeah,
start.
2 minutes. Thank you.
Yeah, sure. Yeah, okay. Please, anyone has a comment, he can raise it or write it in the chat box.
So, Dr. Basim, in general, I will restrict to the task of the topic, and I will use information inside the topic only.
Yes.
Mm.
And usually there is options, there is alternative, but don't offer it by yourself. If you offer an alternative in any communication scenario, means they will fail you. Why? Because you are here to do the task. I know you know the alternative, but it's not the task. The task is to do something. You have to finish it. If the surrogate asks you, doctor, I read about 1, 2, 3. You can give him, yes, there is possibility to have this. However, in the best interest of you and your condition, the decision was for this. Then you will do this, or you can convince him about this. Okay. But if you raise the option or the alternative by yourself, consider the failure of the station. Okay, so here or any other scenario, for example, let's talk about other. For example, counsel a patient about biological therapy or methotrexate for rheumatoid arthritis, and you start to explain and the side effects, but the patient told you, doctor, I feel doubt about this medication. I don't take this medication. So you will offer him, yes, we have another option called biological therapy. This medication 1, 2, 3. Here you consider yourself in the scenario. But if the surrogate himself asks you, doctor, I read about medication called, for example, rituximab or infliximab, or biological therapy, how that sound for the medicine? Okay, you can tell him, I appreciate your knowledge about this condition or about this medication, and thank you for sharing this with me. Yes, it's one of the possibility. However, in the best interest of your condition right now, the consultant recommended to start you on this medication, which is called methotrexate. So by this way, you try to convince him, and you appreciate his knowledge, and you give him the option later on. It's not right now, maybe later on, in case of the failure of our medication today. Maybe we'll consider this line in the future. Okay, the same as the procedure. There is possibility or there is task to explain about lumbar puncture. But the patient told you, doctor, I'm afraid I don't want to do this surgery. I read about MRI, for example, to diagnose meningitis or subarachnoid hemorrhage. If you yourself raise the option of MRI, they might fail you. Why? Because the task is CSF. But what if he asks you, doctor, what about imaging called MRI? I read about it, it's help to diagnose. You can again appreciate his knowledge, and in the best interest of your condition, the consultant and the team recommend to start you or to do this surgery for or to do this procedure for you. And if we couldn't do it, we can consider the imaging later on. But in the best interest for your condition and for the best to diagnose you, we think about this or we recommend to do this procedure. As you said, stick to the scenario task. Don't try to explain something added or to add something from your mind that could be done. Yeah, there is possibility, but it's not your decision. This is a decision of team or a decision of the task or a decision of consultant, which is written in the task. If not written in the task, I will not raise it unless he is asking me about it. Clear now?
Thank you. Thank you so
Yeah,
much.
most
All right, I'm ready, Dr. Basim.
yeah, here you go.
Hello, I'm Dr. Henry, one of the doctors here. May I confirm you are Mr. Sebastian Schneider, 32 years old?
I am the mother of Mr. Sebastian Schneider. I am Monica Schneider.
Okay, so sorry, Monica. I'm here concerning your son, Mr. Sebastian. I don't know if this environment is okay for us to discuss, or you want any of your family members to be aware we discuss.
It's okay, doctor, no problem.
Okay. I came to discuss concerning the health condition of your son. And just to ensure we're on the same page, could you please tell me what you know concerning your son's condition?
Yes, what I know, he was yesterday while driving home from work. He was involved in a car accident. He was traveling on the main road at a normal speed when another vehicle suddenly swerved into his lane. I know the impact was strong enough to deploy the airbag. Afterward, police and ambulance arrived shortly after. That's what I know about his condition. I wanted to know what's his condition now, doctor.
Actually, what you said, he was in place, but I'm afraid I have some serious news for you.
What's problem with my son, doctor?
Actually, Sebastian, your son, has suffered from a very severe injury to his brain following the accident that he had. We've done all that we could do. We've do all the tests and all the management plan, and I'm so sorry to tell you that he was reviewed by two professional doctors who are specialized in this condition, and they both confirmed that he has no brain activity.
What does mean that doctor? I didn't understand. What do you mean with that?
I'm afraid to tell you that Sebastian is dead.
Oh, my son. Are you sure, doctor?
So sorry to inform you, we did our best, but I'm afraid he died.
Is his heart not beating more?
Um, Miss Monica's currently we just we've, we placed on a we placed him in a ventilation currently now, just to ensure that, because of what I'm about to discuss with you now. I don't know if it's too early for me to discuss with you this, but I just have to let you know. Mr. Sebastian is a young man, and I don't know if this is the right time for me to inform you this, but I don't know if you've if your son told you about him opting in for organ donation.
Sorry, doctor. I want to see my son here now.
Um, Miss Monica, it's your right to see your son. After our discussion now, I'm going to ensure that you see him, and whatever rights that you have, maybe based on your religious rights or based on your cultural rights or traditional rights, we support you to ensure that you have such rights. Its final rights will be given to him as accorded.
Okay, doctor. When can I see him?
Yeah, as soon as we finish discussing, I will definitely take you to him.
Okay, you can complete now, doctor. I want to see him
Okay,
as
thank
soon
you.
as possible.
All right, thank you. So I was asking you if you have any idea what if he has opted for the organ donation services.
Yes, I think he has assigned for organ donation and he has also card.
Okay.
Admission card.
As it is the protocol of the NHS that whoever that is opting for it will have to seek for his I don't know if you are the if you have the legal proxy, if you have his legal proxy of, or if he has the legal proxy why he was still alive. Do you know if he has legal proxy?
No legal proxy. He was young and normal. Why
Okay.
should he have legal proxy?
Okay. So we need to seek your consent and your take. What do you, if for you to consent for us to, ensure use some of his organs for as part of the organ donation. But we want
Yes.
to assure you that we want to make sure that. Pardon?
I don't understand why you need my consent. He has assigned for organ donation before that
Yes.
happened.
That's your question is valid. Actually, even if an individual has opting for organ transplant, we still need to have a consent from his family members before we proceed to that act. That is why we are doing this. Do you have any other concern?
How will this be done? Will he feel pain?
That is your. I can imagine what is going through your mind, but not to worry. With he's like I said, he is dead. So whatever thing we are doing is going to be done by the special surgeons that will, do it peacefully and close him up peacefully, and the body he'll be left. He'll be taken to you to perform the normal cultural, traditional, religious rites you want to do with him. Any other concern?
Will this delay funeral?
Not at all. Not at all. Not at all. I'm assuring that as soon as we've gotten the consent for you, the team will start their own, and as soon as possible, we'll hand it over to you for its final right.
Can you assign this certificate?
Can I do what? Sorry, certificate.
For this?
Do you mean death certificate?
Yes.
Yeah.
Because I wanted to organize his funeral and.
Since the cause of his death is
2
known,
minutes left.
definitely following that, we will definitely assign you the death certificate, and whatever thing we did, whatever organ that is collected from him, we'll definitely let you know.
Yeah,
Do
and
you have
will
any
his
other
body,
concern?
yes, I have concern. Will his
Okay.
body be disfigured?
Your question is in order. He will not. The body will not be disfigured per se, because the special surgeons that we perform this with the surgery on the body, we ensure that its body is well preserved for any particular rites that you want him to undergo. I don't know if I've answered your question.
Okay, thank you, doctor. I want to see can I see my son now?
Yes, you can. I will talk to the nurses, and you, after our meeting now, as soon as you've agreed for the consent, we'll just take you there right away. Can
Yes,
you? Okay, thank you very
shocked,
much.
doctor. I want to see my son. Thank you.
So you're welcome. You can go and see him now. Thank you.
Till you have 30 seconds. What you can offer here?
For in any bereavement service, if you want, we are here to support you for the bereavement rights, the bereavement service. We have the imam, we have the Christian pastor, we have whatever faith you are currently. There's the hospital have a bereavement service that will accompany you to any form of burial rights you have for him. And all feel free to let us know. We are here to support you all through this journey. Thank you very much.
Thank you.
Okay, time's up. Dr. Ahmed, you can comment now, please.
Yes, I think Dr. Henry is has covered all the topics and the concern in this case. But sympathy was not enough in this case. I avoided from her more sympathy. His young son, and she is his mother. He didn't give enough time to express her emotions. So the time between the concern of organ donation on this topic and the breaking bad news was not enough. Otherwise, he covered all topics. So I give him assessment, clinical communication, because breaking bad news is not enough because he didn't give enough time to express emotion. Borderline clinical judgment was okay for Mark. Concern all answered. Welfare also all answered.
Okay. Thank you, Dr. Ahmed. But I will minus him in the clinical judgment as well. Why? Do you think the consent here is essential or something to be done?
The consent is not when
Exactly.
the died person has assigned for organ donation or he didn't have any card is by law for organ donation.
Yeah, if there is a card or there is a wish, no need to have a consent.
Yes.
If no, yes, this is the time to talk to the legal advisor. They will sit with the family and they will get the consent. Okay. So in here, in this scenario, already mentioned that he has a card and he already assigned and he accepted to donate his organs. No need to have a consent here, Dr. Henry, okay? So we are informing and getting verbal consent, yes. Are you agree to do this procedure? Yes, doctor, we are agreed. He already had a card. That's why we accepted this, okay? This is regarding the consent and the clinical judgment in this point. The second point, how was the explanation of the condition? What do you think, Dr. Henry? You took long time to explain, but you didn't mention brainstem death, right?
Yes, I think he didn't draw for brainstem. Drawing is also here. Has not said there is here
Yeah,
the center controlling his breathing and his heart,
exactly.
vital organs.
Exactly. So, and any scenario, please, anyone having a scenario with a clear task, try to mention the main diagnosis, the main disease, the name, the main medication name. Don't talk about other or explanation before saying the term itself. Here, how should I start? Yeah, I'm Mr. X, I'm Dr. X, you are Mrs. Monica. And by the way, this is not correct. It's a fatal mistake to ask about a patient who is in coma. You are talking to the mother. Take care. You have the data of the patient and the data of the mother. So I'm talking to the patient mother. Are you Mrs. If you don't know her name, you are the mother of Mr. Schneider. Yes, I am. He is 20 years. Yes, he is. I'm Dr. X, one of the doctors here. I wanted to speak with you about his condition. What do you know? I don't know, doctor. He had an accident, and I just knew about the accident. I came here to know about. So, what do you think ongoing with him? I don't know, doctor. Maybe he has just trauma to his head, trauma to his body, but I think he will be fine. You have to ask this expectation always. So from this expectation, I will address first concern. No, I appreciate your worry, but I don't have good news today. What happened, doctor? Please tell me what happened to my son. Is he fine? Okay, Mrs. Monica. I'm afraid to say he has a condition called brain stem death. What do you mean, doctor? It's here you have to warning shot, bad news, then the golden silence. What do you mean, doctor, by brain stem death? Now the time. Let her react. What she reacts, she'll say, "Oh, it looks something complicated. Is it serious, doctor?" Now you start to explain what is the brain stem death. Yes, I'm afraid to say his brain is not functioning anymore. The vital or the most important part in his brain, which we call it brain stem, the part in the bottom of his brain that transmit or to control the breathing, to control the heart, control the life, it's not working anymore. So, doctor, is he alive? Yes, thank you for sharing this or asking this question. Actually, his heart's still beating. However, he's not feeling any surrounding. He's in deep coma. He is not responding to anyone. He has no response, whatever you want to mention. But his heart's still beating, maybe by medication and the machine supporting his breathing. If we stop those, he might be dead. I'm so sorry to be the one delivering this news today. I'm afraid. I'm sorry for your son loss, and appreciate her reaction. She will cry. She will do whatever. Sorry if you want tissue, you want water, any of these. Are you sure, doctor? Is it my son? Is it the is it confirmed? Yes, I'm afraid to say we are not delivering such news unless we are sure 100% and double checked the news, the information of the patient name, the patient age, and confirming those data before delivering them to the father or the mother. What you will do now, doctor? Yeah, our process now is to talk about the next step is organ donation. Have you ever heard about it? Yes, doctor. My son signed a card for organ donation. Now you can appreciate his good thing. Yes, I appreciate that. It's a good step from him. He can help a lot of people, a lot of patients that need his organs. It's something will reward him. So what they do, doctor? What the process? The process we will talk with the team who can take this and we'll do the surgery for him, and we'll try to do it as soon as possible. And what about the death certificate? Yes, we will be provided as soon as possible after finishing this process. What about the funeral? We will try our best not to be delayed and everything will go smoothly. The disfigurement, we will be sure that be sure that the team who do the surgery are experts. They do it many times. They will do it without any disfigurement. Thank you for your time, and I'm so sorry again for your loss. If you have any concern, we will send you to the bereavement team, spiritual team. They can sit with you, they can support you, they can support your family, anything you need, because we know he's your young son in this way. Thank you again, thank you. And that's it. Okay. So what you did, Dr. Hina, again, for the explanation itself, you explained in complicated way, but you didn't say the name. What happened to his brain? What the condition called? And this is the task itself, brain stem death. So mention it and explain it. You explain it without mentioning it. For this, I will minus you in the clinical communication and the clinical judgment as well, because no consent here is needed. For the welfare and concern will be maintained, so you can get 12 out of 16.
Okay, that's okay.
Yeah, it's common scenario,
Yeah,
and you
yeah.
have to get ready for it. A very difficult one. Always give a chance to the surrogate to react. It's hard news. This is what I felt also, as Dr. Ahmed said. You didn't do or you didn't do or show this empathy. Although she has the son who is dependent or not dependent on her, or You don't know, is he the first or the second, or he's the only son. You have to provide a lot of empathy for her. Okay. Any other question, Dr. Henry? Dr. Ahmed, you want to add any comment?
Thank you, Dr. Basim.
Okay. Again, Dr. Henry, you have any question? Anyone want to comment? Dr. Mahjoub? It's clear for all. So it's
Yes.
yeah, the time to end the session. I think
Thank
all
you.
of
Thank
you.
you so much, Dr. Basim.
Yeah, okay. Thank you, Dr. Henry.
Thank you, Dr. Basim.
Most welcome, Dr. Ahmed. Anyone want to comment before ending the session? There is a comment,
Yeah.
sorry. شكرا. Okay, thank you.
دكتور باسم السلام عليكم.
عليكم السلام ورحمة الله وبركاته. Yes.
Just I'm asking about the consent. Just I want to
Yes.
confirm, need a consent or not?
No need for consent.
Actually, I want to comment before I hear too many theaters. They said they need a consent, even if the patient during his life he said he want to donate, and after death, the family they refuse donation. In this situation, we don't have to take a decision of donation.
I
That means,
said no need for a written consent, but there is verbal consent. Yeah, there is
I'm not sure,
consent
but
as. Yes.
yeah,
Continue, yes, Dr. Ahmed. Yes. What you want to say?
yeah,
Yes.
I hear from two different theaters. They said even if the patient before his wish to consent, sorry, to donate, and his family after death they refuse, we have not to take his organ donation.
Okay, let me clarify this point. We talk here about the
Okay.
consent as approved by the mother. Here in this scenario, she's agreed, right? She said, okay, because he had the card.
Yeah.
Does
Yes.
she need to sign a consent? No need. What if
Okay.
she
Okay.
said, no, doctor, I don't accept this process. I don't accept this. I don't want you to take any organ from my son. This is the time to abort and to have another meeting with the legal advice to sit with her and try to convince her as a verbal consent. Again, it's not as written
Yes.
consent. Why?
Yes.
Because
You're
we
right.
had
All
the
right.
card itself. Okay, what
Yes.
if we don't have the card and he didn't sign any wish or any paper or any document? Here, the time to have a consent from the family as calling after calling the legal advisor. So you have three
Yes.
scenarios. Either the patient himself sign a paper or a card. He just need to inform what we call it formal consent. Okay. So we are
Yes.
informing the family that he had a card, and if you are agree, we will process. This is the first situation. So both of them are agreed, and we have documented approval from the patient. The second scenario, we have documented approval from the son or the patient, but the family are not agreed. Now we will try to convince them, provided that we have a consent from the son himself. Shall we proceed? No, we will not proceed unless they agreed. How they agreed? Verbally only. So whenever you have accepted verbal agreement from the family, now we can proceed with the donation. The last situation, the patient himself doesn't sign anything. He didn't expect that. He's not talking about this issue before. And the son or the mother or the relative agreed. Here he should sign the consent. Okay? In the attendance
Okay.
of legal
Okay. Thank you,
advisor.
doctor.
Yeah. If the family are not accepting and the patient didn't sign, everything will be aborted. After organ donation team the sit with the family. If still refusing, now cancel the surgery or cancel the procedure and the process and finish. You can make even the patient DNR, not to resuscitate. So be careful about these three situation. Today's scenario was about a card. So I have a powerful paper or a powerful document. This is accepted process by the patient himself before the accident in his life. So I should support it. I should provide it to the family, and I will try to convince them. Okay. I hope it's clear for all. It's usually doubtful one. Every session with the organ donation, brainstem this, we have this conflict. But it's clear whenever we have a card, we will try to just do the informed consent to the family, verbal consent that your son or your patient has approved. If they are agreed, if not agreed, we will try to convince them through the legal advisor, provided also that there is a consent or there is a document or there is a card. The last one again, if not or no card there, we will try to have a consent from the family. Okay. Thank you, Dr. Ahmed, for your question. It's a nice one because it clarified this point. And usually we have this debate every session with the organ donation. Anyone has other comment? Or
Dr. Batim.
most welcome, Dr. Ahmed. Anyone comment? Anyone with other comments? Clear for all? Okay. So now the time to thank Dr. Henry and Dr. Ahmed
Thank
for,
you, Dr.
for
Nabil.
sitting the session today. Wish you a nice and happy weekend. See you inshallah in the Saturday. Good luck and good night. Assalamu alaikum wa rahmatullahi wa barakatuh.
Thank you so much.
Thank you.